Okay, you ready?
Yes.
Okay. Hi, Heather. It's nice to meet you. My name's Amanda. How are you doing today?
Good. How are you?
I'm doing well. Thanks for asking. So tell me a little bit about yourself.
Well, I've been a nurse for 25 years. I work in academia, med surg, OR, ER, and a lot of other areas. I published research and I wanted to take my career to the next level. So I decided to go into the next level, which was nurse practitioner. And so I started my degree at Regis College, and I'll graduate in December. So I'm looking for a position now with your company, the Guidance Center. I've looked at your profile online, and I really like what's going on at your facility, and it aligns very closely with my culture and ethical values. So
Okay, so that kind of helps on why you want to work here. How did you find out about us?
online, did some research, have talked to a recruiter, and found out a little bit more about you, like your top 3 diagnoses, that you are government funded, that you do have tuition reimbursement. There's a lot of good things about the company that I really like. You also do in-house psychological testing, and I'm very data driven. And I like to be able to have that psychological testing as a backup for why I'm diagnosing what I'm, the meds that I'm giving, because that gives me the data to back it up.
Good, good. Well, it's nice to know that you've done your homework. That makes us feel a little more comfortable talking to you. Great. So what attributes do you have that will help you to become successful in this position?
I'm research based, so I really like to look at the research and keep up with what's going on in the field. I'm energetic, I'm intelligent, and I'm hardworking. And I really feel like I'm a team player, so I can really contribute to the team here.
Great. Okay. Well, good. We definitely need team players in research and be able to communicate with others. How do you think a supervisor who knows you well would describe you?
Um, a leader, someone who is confident and secure in who they are and not afraid to take risks, but also I own what I do. So I'm very based in my knowledge and can back it up. So it makes me more confident in what I can teach others and what I can share with others, as well as what I learn from others. So
Good. Good. All right. So you've had some good rapport with them.
yes.
Okay. And then describe a situation in which you recognized a potential problem as an opportunity, and what did you do?
I had a situation when I was in academia where I was teaching mental health, and my students were having a hard time understanding how schizophrenia and the voices was impacting their patient population, and they were having a hard time with empathy. So I wrote a grant, and I won the grant and was able to buy 15 iPods. And then I took a colleague into our simulation lab, and we recorded a 5-minute video, or not video, but audio recording of voices and horrible noises. I downloaded those onto the iPods, and then I had them do a pre and post test that consisted of math problems that were basic to what they had learned. So they did the math problems once without the audio, and then we scored them, and then we had them put the iPods in their ears, and they were limited on time. They had to do the test again. It was after clinical, and they were surprised that they scored much lower on the post test, even though they had already seen the questions, and how much the voices really impacted them. So to help them develop empathy and help them understand how schizophrenia really impacts people's lives and how difficult it is to live with.
That's great. Sounds like, yeah, so it sounds like you're really passionate about this. Good. Okay. Well, do you have any questions for me at this point?
I would like to get your email, because I'm sure I will. I've done a lot of research, and we talked a little bit before.
Right.
And so I just need some time to process all of the information. Okay. I'd like to be able to reach out to you if I can.
Yeah, no problem. We'll get that set up, and then we'll talk soon, okay?
Great. Thank you so much.
All right.
I appreciate your time today.
No problem. Nice meeting you.
Nice meeting you too.
All right. Great job.
Hey. Good job. All right. Are you ready?
Sure. I have no idea what I am, but go for it.
Okay. All right. Well, good morning, Amanda. My name is Heather Buck. I am the supervisor here, and I wanted to say thank you for coming in and meeting with me today. Tell me a little bit about yourself.
Okay, sure. It's nice to meet you too, Heather. Thank you for having me. So I've been a nurse for about 8 years, most recently family nurse practitioner for the last 3, but realized that medicine is not my true calling. Got into working with a psychiatrist as a rounding nurse, and that's what I wanted to focus on. Found out that's what I really like, and that's my passions, which led me to go back to school to get my postmaster's, which I'm currently finishing in December, and looking to expand my career field.
Fantastic. You sound passionate about what you're doing now.
Yeah.
You've really found your niche. What made you want to go into the psychiatric field? What made you want to follow this person?
Right. Well, I think it's one of the fields that is kind of misunderstood, and not a lot of people like to go into it. They feel a little intimidated by it because it can be so vague, and the patients can be a little bit more difficult. And it's just something that I was kind of drawn to, and it's really the only part of medicine that I actually understand and kind of get. I can empathize with the patients really well. I like to listen to them. There's no judgment here. If you're hearing voices, that's unfortunate, but at the same point, kind of getting to the root of the problem and figuring out what's going on, it just kind of interests me, and the only thing that I really understand and actually really like to do.
Fantastic. Great. How would you be an asset to our practice here?
Right. Well, so even though I'm not a psychiatric nurse practitioner yet, I have been working in the field for the last 2.5 years. So I've been exposed to many different diagnoses, worked with a lot of different physicians and interdisciplinary fields in the hospital setting. So I'm motivated, hardworking, very used to being organized, pulling charts, knows the medications already, know the types of diagnosis that we're looking at and the type of patients. So I think I'll be easy to just kind of slide on in and just get into the role of being the provider instead.
Great. I love that answer. What do you consider to be your biggest weakness, and how are you overcoming it?
I would have to say my husband probably would tell me my nonverbal communication. I wear my emotions pretty openly, and if something is not to my liking, it can kind of show on my face. So of course, working with psych patients, we need to be mindful of that. So I'm constantly trying to keep not a flat face, but just kind of neutral and even, so that way they learn to trust me until we can kind of form that relationship.
Good. It's good that you've recognized that. That's a big component of emotional intelligence. It's excellent. Where do you see yourself professionally in 5 years?
Right. So that's a hard question, but I think it's something that we should always look towards the future and kind of have that goal in mind, even if it changes, because it shows that we're always willing to learn and grow. I'm kind of thinking that maybe down the line doing something more solo. Hopefully that Texas will get to where we can do more independent practice, kind of open up my own and take on patients and be that more holistic provider.
Fantastic. Well, thank you so much for meeting with me. Do you have any questions tonight?
I think that's good. I got your email on the way in, so I'll be in touch with you and kind of see where we can go from here.
Okay. Well, we'll be reaching out to you for another interview.
Great. Thank you.
Thank you.